Hey guys, welcome back to my channel, The ENT Resident. Today, our topic of discussion is benign intracranial hypertension. This is also known as otitic hydrocephalus. You can also now purchase my notes. I have added links in the description. So let's get started with our topic. Now, why is this topic important? This is important because this is one of the rare complications of CSOM that you need to know about. So, what is benign intracranial hypertension? It is a disease which is characterized by, as the name already suggests here, a raised intracranial pressure in the presence of normal CSF findings. This disease is also known as otitic hydrocephalus, and it is a rare complication of acute otitis media and chronic otitis media. This is seen in children and adolescents. Let's talk about what is the pathophysiology of the disease. So, after there has been a middle ear infection, which can be in the form of acute infection or a chronic infection, it leads to the formation of sigmoid sinus thrombosis. Now, from here, it can go via two pathways. One is the presence of sigmoid sinus thrombosis leads to the obstruction to venous return, and this will cause a raised intracranial tension. And the other hand of this is the presence of sigmoid sinus thrombosis. If this thrombosis ends up extending to involve the superior sagittal sinus, this will impede the absorption of CSF through the arachnoid villi. So, if there is a decrease in absorption of CSF happening, so there will be more buildup of CSF happening inside inside the spinal column. So, in that case, it will lead to the development of a raised intracranial tension. That's how it leads to the development of benign intracranial hypertension. Now, what are some clinical features that you will be seeing in such a patient? So, all the clinical features that we'll be seeing will be because of a raised intracranial tension. So, the most important presenting complaint over here is the presence of severe headache due to this raised intracranial tension. And this can be associated with nausea and vomiting. Secondly, the patient will also come to you with diplopia on lateral gaze. This occurs because of the involvement of the sixth nerve or the abducens nerve, which leads to the development of lateral rectus palsy. So, in this case, we'll be seeing a diplopia on lateral gaze. Third, patient will also complain of blurring of vision, and this will be due to the development of papilledema and optic atrophy. Now, the papilledema that develops usually is of 5 to 6 diopters, and it can sometimes present with patches of exudate and hemorrhages. So, in this case, you should definitely be looking at the optic disc. Next is nystagmus. So, these are the four important clinical features that this patient will present to you with, and the most common one is the presence of severe headache. Now, how will we investigate the case? First is lumbar puncture. Now, lumbar puncture has to be done with a lot of care and caution so as to avoid the herniation of cerebellar tonsil. So, what will we find on lumbar puncture? CSF pressure will be more than 300 mm of water. Now, what is normal CSF pressure? Normal CSF pressure is 70 to 120 mm of water. So you can see how the pressure over here is excessively high. This is the cause for the raised intracranial tension over here. And the rest of the CSF findings will be normal. It will be bacteriologically sterile, normal in cell count, protein, and sugar content. Secondly, we'll perform an MRI to help in better evaluation of the venous sinuses. Last of all, let's talk about how will we treat this disease. So, the treatment of this disease can be divided into two parts: medical and surgical treatment. First, let's talk about medical treatment. There are two aspects that we need to think about here. First of all, we know that the core pathology over here is raised intracranial tension. That means it has a raised CSF pressure. So, what do we need to do? We need to reduce this CSF pressure. So, what are some drugs that are used in this case? They are corticosteroids, mannitol, acetazolamide, diuretics, etc. Second aspect of medical treatment is to treat the main causative factor here, which is the middle ear infection. So we'll be also giving IV antibiotics to the patient. Next, let's talk about the surgical aspect. So there are three options over here. First of all, again, is to reduce the raised CSF pressure, because if the CSF pressure continues to be raised for a long period of time, it will lead to optic atrophy and blindness. So to prevent this, we have to perform certain procedures. First option would be to perform a repeated lumbar puncture or place a lumbar drain. Second is a lumboperitoneal shunt. A lumboperitoneal shunt drains the CSF into the peritoneal cavity. Second, we have to treat the middle ear infection. So, we'll be doing a mastoidectomy, and this will also help you in dealing with the sinus thrombosis that has happened here. Third is we'll perform an optic sheet decompression to prevent the development of optic atrophy. So that's all about benign intracranial hypertension, also known as otitic hydrocephalus. It is a rare complication that we see in a case of CSOM. If you have any further questions, please note them down in the comment section and I'll get back to you.